Let's take a look at the real origin of the vagus nerve. Now, this is a little bit tough. We've got three sensory components, and I'm going to use my beloved blue color to demonstrate them. We've got the dorsal sensory nucleus, which is pretty small, sits right about here. Then we've got the round nucleus that sits right next to it, slightly posterior and lateral to it, and that is also a sensory component. And then we have the nucleus of the solitary tract, which contributes to 9 and 10. That's going to be over here. Now let's go for some motor contribution, real origin structures. And these you're familiar with from the glossopharyngeal nerve. One is the nucleus ambiguus, and it contributes, actually it's a little more posterior, right about here. Do a little racing right there. And then we've got posterior to that, and a little more medial right under the fourth ventricle is the inferior salivary nucleus. And the inferior salivary nucleus actually travels just mesial or medial to it is the spinal nucleus of the vagus nerve, which I'm just going to put as a little blip with another little red dot next to it. So that is the real origin of the vagus nerve. Now, besides giving some output to various organs, the vagus nerve comprises between 80 and 90% of afferent nerves, mostly conveying sensory information about the state of the body's organs to the central nervous system. The real origin of the vagus nerve, rather complex, giving rise to the actual apparent origin of the vagus nerve, which has an anterolateral course and then reaches a space between the carotid artery and the jugular vein.